Hello everyone and welcome back to MediInsights. Today we're looking at Betamethasone Tablets, a powerful corticosteroid used to control inflammation and immune reactions. We'll explain what it treats, how it works, typical dosing, side effects, and practical safety advice so you can understand this medicine better with clear, reliable information. To start, here's why someone might be prescribed betamethasone. Betamethasone tablets are used to treat a wide range of inflammatory and allergic conditions where a strong systemic steroid is required. Clinicians commonly prescribe them for severe allergic reactions and for acute flares of autoimmune diseases such as rheumatoid arthritis and lupus. They are also used for serious dermatologic conditions that do not respond to topical therapy and for selected hematologic or oncology protocols where glucocorticoid action is beneficial. Oral betamethasone can help control asthma exacerbations when an oral steroid is indicated, and it may be used for severe inflammatory bowel disease flares under specialist care. In some neurological situations, it is used to reduce cerebral edema, but such use is closely supervised in hospital. Because betamethasone is potent, it is generally reserved for short courses or for conditions where other treatments have failed. Long-term management usually prefers lower potency or targeted therapies to limit systemic risks. Your treating doctor will decide if betamethasone is appropriate based on the severity of your problem and your overall health. Never start or stop this medicine on your own, and always follow the indication and duration set by your prescriber. Now, let's talk about the dose and how often to use it. Dosage of betamethasone tablets varies widely and is individualized according to the condition being treated, its severity, and the patient's response. For adults, the commonly cited oral dosing range is approximately 0.6 to 7.2 milligrams per day, given as a single dose or divided doses, and shorter courses often use 2 to 3 milligrams daily at the start with a gradual reduction as symptoms improve. Pediatric doses are weight-based and are adjusted by the treating pediatrician, with smaller fractions of adult doses for younger children. For long-term therapy, the aim is to use the lowest effective dose to control symptoms, and clinicians will consider switching to a less potent steroid or alternate therapy when possible. When systemic therapy has been given for more than a few weeks, a tapering schedule is usually needed to reduce the risk of adrenal suppression, and abrupt withdrawal should be avoided. Because betamethasone is more potent than prednisone or prednisolone, equivalent doses are lower, and any conversion or adjustment should be done by a clinician. Always follow the exact dosing and tapering instructions provided by your prescriber, and ask your healthcare team if you are unsure. Special monitoring typically includes checks of blood sugar and blood pressure during treatment. Next, a simple look at what betamethasone does once you take it. Betamethasone is a potent synthetic glucocorticoid that crosses cell membranes and binds the intracellular glucocorticoid receptor. The drug receptor complex moves into the nucleus and changes the transcription of many genes that control inflammation and immune responses. This increases anti-inflammatory proteins like lipocortin and reduces production of pro-inflammatory cytokines and enzymes such as interleukins and cyclooxygenase 2. By inducing lipocortin, betamethasone inhibits phospholipase A2, which lowers arachidonic acid release and downstream prostaglandin and leukotriene synthesis. It also reduces migration and activation of white blood cells and decreases capillary permeability, which together reduce swelling and redness. Steroids also have some faster non-genomic actions that can alter cell signaling and vascular tone and help symptoms settle quickly in acute situations. Because betamethasone has high glucocorticoid potency and a relatively long duration of action, its anti-inflammatory effects are strong and prolonged, which is useful for severe disease, but increases the need for careful monitoring of metabolic and immune side effects. These systemic effects commonly include raised blood sugar, altered fat distribution, protein breakdown, and loss of bone density when used long-term, and they can suppress the body's own cortisol production, which is why tapering and monitoring are essential. Keep in mind it may cause unwanted effects in certain people. Like all systemic corticosteroids, betamethasone can cause many side effects, and the likelihood depends on dose and how long you take it. Short-term effects often include increased appetite, weight gain, fluid retention, mood changes, and difficulty sleeping. Steroids can raise blood sugar and blood pressure, so people with diabetes or hypertension need close monitoring. Betamethasone suppresses the immune system, which increases the risk and severity of infections. With prolonged use, more serious issues can occur, such as osteoporosis, muscle weakness, peptic ulcers, and slower wound healing. Chronic exposure can cause Cushingoid features like rounded face and increased abdominal fat, and it can cause skin thinning and easy bruising. Children may experience growth suppression, and older adults are at higher risk of fractures. Steroid therapy can also lead to cataracts, glaucoma, and psychiatric symptoms including anxiety or depression in some people. Long-term treatment may suppress your own cortisol production, so tapering is required, and it is helpful to carry a record that you are taking steroids. Discuss any worrying symptoms with your healthcare team promptly, especially signs of infection, severe stomach pain, sudden vision changes, or marked mood shifts. Your doctor will balance these risks against the benefit for your condition. Before you go, here are some key safety points and tips. Always take betamethasone exactly as your prescriber tells you, and do not change the dose without medical advice. Take the tablet with food to reduce the chance of stomach upset, unless your doctor instructs otherwise. If you have been on systemic steroids for more than a few weeks, do not stop suddenly, because abrupt withdrawal can cause weakness, low blood pressure, and adrenal crisis. Tell all your healthcare providers that you are taking steroids, especially before surgery, and carry written information or a steroid card when possible. Discuss vaccinations with your clinician, because live vaccines are often avoided during immune suppression and timing matters for safety and effectiveness. Monitor blood sugar and blood pressure during treatment if you have diabetes or hypertension, and report new infections or unexplained fever promptly. If you are at risk for osteoporosis, ask about bone protective measures such as calcium, vitamin D, lifestyle changes, and bone density checks when steroids are needed long-term. Review all your medicines with the prescriber because some drugs can increase steroid levels or interact with their effects. If you are pregnant, planning pregnancy, or breastfeeding, talk to your doctor about the risks and benefits before using betamethasone. Thank you for watching this clear guide to betamethasone tablets. If you found it useful, please subscribe to MediInsights and leave a comment with your questions or experiences so we can cover topics you care about in future videos soon.